A 25-year-old is getting a second chance at a normal life after living in chronic pain for 7 years. Velena Jones is here now with her story. Velena?
Yeah, Susan, endometriosis affects 1 in every 10 women worldwide. It's a condition that you can't see, but the impacts can be life-changing. And for Katie Maxwell, it was a pain she thought she would have to live with for years to come.
It's terrible. You tell people that there's something wrong with you, they don't believe you.
Katie Maxwell spent 7 years in pain, a time filled with hospital visits and countless doctor's appointments.
You look fine, you make it to work, you look healthy, but they don't know. I may have been up all night throwing up. I may have been, up all night in pain, and I go to work the next day.
At 18, after high school graduation, Katie began feeling unbearable pain, causing her to regularly faint and stopping her from doing the activity she loved, with medications and experimental treatments offering no relief.
How am I going to do this for another 10 years? There's got to be another option. There's got to be another way. But there really wasn't a lot of hope.
5 years later, she was finally diagnosed with endometriosis.
A lot of physicians sometimes normalize their symptoms, and this leads to a pretty big delay between patient presentation and when we actually diagnose the disease.
The condition that affects 5 million women nationwide happens when the tissue that normally lines the uterus grows outside of it and onto other areas in the body.
There's an entire spectrum of pelvic pain, and sometimes we can't get it to go away completely, but getting women back into their daily routine and increasing their quality of life is pivotal and obtainable.
UW Dr. Kara King is 1 in only 3 people in Wisconsin to specialize in the laparoscopic incision of endometriosis, helping to eliminate the root cause of symptoms.
I remove those excisions completely. You're actually dissecting that off of the underlying structures, but by removing all of those lesions, they're no longer being influenced by the ovarian hormones.
Now 4 weeks post-surgery with no pain in sight, Katie is back to her old self.
I had a really hard time seeing the positive because I wasn't getting positive results, and I think the new Katie is so happy, so happy. I am so fortunate to have found the help that I needed because it was such a struggle.
Now, Katie says she's now looking forward to enjoying the rest of her 20s, and first thing she tells me she's going to do is get back to running and the dating world.
Good for her. Boy, that's a very hopeful story that will give a lot of other people hope as well.
Absolutely.
Velena, thanks so much.